nurse practitioner. Can you tell me your name and your date of birth?
Kevin Willis, 4/15/92.
Okay, and do I have your consent to upload this video?
Yes.
Okay, I'm gonna wash my hands and we're gonna start your musculoskeletal exam. So first I'm gonna start with inspection of the hands and fingers. So I'm going to look for symmetry. I'm gonna look for any atrophy, any swelling, any nodules that may be present, none of which I see. Everything looks nice and normal here. Then I'm gonna go on to my palpation. I am going to palpate first the proximal and distal interphalangeal joints. Any tenderness or pain when I'm palpating? Oh. Okay, and then I'm gonna move on to my carpals and my metacarpals. So I'm just gonna palpate for any tenderness, pain, nodules, okay, and everything feels good there. So then I'm gonna move on, I'm gonna have you flex your fingers, so just hold your hand still and put your fingers down. You can do both at one time. Yep. And then up, extension, perfect. And then I'm going to have you abduct your fingers, so apart and adduct. And then I'm going to have you make fist with both. Perfect. Okay, next I'm going to move on to the wrists. So I'm going to inspect them for the same things, for symmetry, for any nodules, any redness, any deformity, atrophy, all that good stuff. And then I'm gonna palpate the, actually I was supposed to palpate the carpals and metacarpals with the wrist, but we already did that. So I would palpate the carpals and metacarpals here. I don't think I did the MCP, did I? I got those mixed up. I think I got the MCP. I switched the tarsals and the MCP, hold on.
Alexa, tell me notification.
Kevin, there's one new notification from Amazon Shopping. Your return was received and a refund has been issued for $27.81.
I got those mixed up. So I'm gonna start over and do the MCP.
You got like $80 on Amazon.
Okay. Hi, I'm Emily. I'm gonna be your nurse practitioner. Can you tell me your name and date of birth?
Kevin Willis, 4/15/92.
Okay, and do I have your consent to video this exam?
Yes.
Okay, so I'm gonna wash my hands and get started with your musculoskeletal exam. So first thing I'm gonna do is inspect his hands. So I'm gonna inspect for any redness, any atrophy, any deformity, any nodules. You can just put it down. And none of which I see. Everything appears normal here. So then I'm gonna move on to my palpation. So I'm going to palpate the distal and the proximal interphalangeal joints on both hands. And I'm palpating for any pain, tenderness, any nodules, fluid, any pain, tenderness, okay. Then I'm going to move on to the metacarpophalangeal joints, the MCP joints. So I'm just going to palpate here, any tenderness?
No.
Perfect. Okay, and then for range of motion, I'm gonna have you make a fist, okay? And then I'm going to have you flex your fingers. Yep, extend your fingers. And then abduct and adduct. Perfect. Okay, so that's all for the hands, so we'll move on to the wrists. I'm going to inspect for the same thing, so I'm inspecting for any redness, any atrophy, deformity, swelling, nodules, none of which I see. And then I'm going to palpate the carpals and the metacarpals here. So I'm just going to palpate. Any pain or tenderness with that?
No.
Okay. All right, and then I'm going to go to range of motion with the wrists. So I'm going to have him flex your hands, extend, and then we're going to do ulnar deviation, which is abduction, yep, and then radial deviation, which is, yes, adduction. And then we're going to do our two specialty tests with the wrists. So first, I'm going to do tenons. So I'm going to have you hyperextend your wrist like I'm doing, yep. And then I'm going to put pressure on the medial nerve, and that would be a positive test if there was any paresthesias or pain. Did you have any pain there? Okay. Next, I'm going to go to Fallon's. So I'm going to have you put your hands together, and you can hold them down like that. Yep. Just, And then I would have him stay in this position for 40 to 60 seconds to see if he had any paresthesias or pain, which again could be indicative of carpal tunnel syndrome. Okay, you got those. Perfect. From there, I'm going to move up to the elbows, and I'm going to inspect the elbows for any deformities, for symmetry, for any nodules, swelling. Everything looks good. Perfect. Thank you. And then I am going to palpate. So I am going to, I'm going to palpate the ulcranon process back here, and then the medial epicondyle, which is going to be here, and the lateral epicondyle. I'll do this. And now we've got the lateral. Okay. And then I'm also going to palpate the extensor surface of the ulna, so that's going to be just right around here on both sides. Okay. Any pain issues there when I'm, okay. All right, so then I'm going to have you extend fully out, yep. And then flex, yep, perfect. And then I'm going to have him pronate his hands, so just put them out, yep. And then supinate, perfect. Okay, everything looks good there. I'm then going to move on to the shoulders. So I'm going to, I would typically look with bare skin, but for the video, I'll just inspect the shoulders for symmetry, for any redness, deformity, atrophy. And then I'm going to palpate. So I am going to find the AC joint, which is here. And then I'm going to move down to the coracoid process on either side. And then I'm going to go to the bicipital groove, feel the subdeltoid bursa, and the greater tubercle of the humerus in this general area. Did you have any pain or tenderness with that?
No.
Okay, perfect. So after we found those landmarks, I'm going to move on to range of motion of the shoulder. So I'm going to first have you flex, so you're going to just straight up. Yep. And then extend, so you're going to put about 60 back. Yep, perfect. And then you're going to abduct, so take away. Yep. And then for adduction, you're going to do one at a time across the midline. Yep. And then, perfect. And then I'm going to have you do internal rotation. So you're going to take your hand, and you're going to just touch your back here. Yep. Yep. And then external, so you're going to touch back here on your neck. Yep. And perfect. Okay, now for my specialty test for the shoulders, I am going to do the empty can test. So you're going to put your hands down like this, kind of like you're pouring out something in a can. And I'm going to put pressure here. Any pain there? Okay, and that was testing for a rotator cuff injury, testing the supraspinatus strength. Then from there, I'm going to move on to the head and neck. So I'm first going to inspect the posture. I'm going to inspect for any abnormalities. Everything looks good there. And then I'm going to inspect for TMJ. So I'm going to place my fingers in front of the tragus, and I'm going to have you open. Any tenderness? Okay, close. All right, and then I'm going to palpate I'm going to come back here, sorry. Palpate the cervical spine here. And then I'm also going to palpate the paracervical muscles, the sternoclavicular notch here, and then the rhomboids and the trapezius muscles as well. Any issues, any pain there? Okay. All right, and then I'm also going to have you, for range of motion, I'm going to have you open your mouth as far as you can. Okay, and that appears normal, should be at least 3 finger breaths. And then I'm going to have you open your mouth, not as wide, and then lateral movement. Perfect, okay. Then I'm gonna do range of motion of your head. So you're going to flex, extend, and then you're going to do lateral, lateral, and then rotate. Both sides, yep. Perfect. Okay, and then I'm gonna do Sperling's test, which is a cervical compression test. I'm just gonna have you tilt your head just a little bit, and then I would press down, and if you had any pain, that could be indicative of a cervical spine issue. Next, I'm going to move on to the feet. So I'm gonna have you lay down.
We lay down.
However, whatever's comfortable. So I'm gonna inspect the feet. I'm going to inspect for any calluses, corns, bunions, warts, any deformity or atrophy. And I actually need you to stand up because I need to see if you're flat-footed. I'm sorry. Okay, so good arch, no flat feet. Okay. So now I'm gonna palpate, and I'm going to palpate, just like I did with the fingers, the proximal and distal interphalangeal joints on both sides. And then I'm going to palpate for the metatarsals, any pain or tenderness. And then I'm going to palpate for plantar fasciitis on either side, and between the third and fourth toe for Morton's neuroma. Okay, so moving on from there, we are going to flex your toes. Yep, curl your toes, and then extend your toes. Yep, and then we are going to invert, so turn your feet in, and evert, turn your feet out. Yep. Perfect. Yep, that's good. Okay, and that completes that. And then we're going to move on to the ankles. We are going to inspect the ankles for any abnormalities, and then we're going to palpate the Achilles on both sides, and then the medial malleolus and lateral malleolus. And from here, I'm going to start my active and passive range of motion. So I am going to have you actively plantar flex, so you're going to put your foot down, yep, and then dorsiflex up, and then rotate in a circle for me. Yep. All right, and now you can just relax, and I'm going to do it. So I'm going to do, this is passive range of motion. So I'm going to plantar flex, dorsiflex, and then I'm going to rotate. Okay. All right, so everything is good with your ankles. So then we're going to move on to the knees. And first I'm going to inspect the knees for symmetry, for any redness, swelling, fluid, and then I'm going to palpate the knees. So I'm going to palpate behind on either side for the popliteal fossa, where a Baker's cyst may be present, and then the sides of either patella, and then the suprapatellar pouch. Any pain or tenderness when I'm palpating? Okay. All right, so range of motion with the knees. So you are going to, right now you're in extension. So if you want to come to the edge of the couch and extend, and then flex. Extend, flex, perfect, okay. All right, from there we're gonna do some specialty tests so you can lay back down. Okay, so first I'm going to start with the valgus. So I'm going to put my top hand on the lateral aspect below the knee, and my bottom hand on the medial aspect near the ankle, and then I'm going to abduct the lower leg, putting pressure on the MCL. Okay. Okay. Any pain or tenderness? Okay, and then I'm going to do the opposite. So I'm going to stress the lateral ligament. So I'm going to place top hand medially, bottom hand laterally, and then I'm going to adduct the lower leg. And I would do the same on both sides. That was the varus. Valgus was going out, stressing the medial aspect, and then varus was going in, stressing the lateral aspect of the ligament. Next, I'm going to do Lachman's test. So what I'm going to have you do is I'm going to have you flex to about 15 or 20 and kind of externally rotate. And then I'm just gonna put my knee here for support, and then I'm gonna anteriorly test for laxity of the ACL, the anterior cruciate ligament. And then I would do that on both sides. After that, I'm gonna do the drawer test. So I'm gonna sit on your foot for this. You're gonna actually flex to 90. So about, yeah, that's good. And then I'm gonna sit on his foot, and I'm going to grab about here, and I'm going to pull towards me and push away. And this is again testing for laxity of the ACL, and this is also for the PCL as well. And then I'm gonna do McMurray's. So I'm going to immediately rotate his leg, and then in this position I'm going to extend. And this can be, if there's pain or tenderness, this could be indicative of a meniscal injury. Okay, so that is it for the knee. We are going to move on to, okay, we're gonna move on to the hips. So for the hips, I'm going to inspect for symmetry. For any, no, actually, yeah, that's fine. Yeah, no, that's good. Okay, and then I'm going to palpate the anterior superior iliac spine, go over to the greater trochanter, and then the posterior superior iliac spine, and then find the sacroiliac joint and palpate that as well. For my range of motion, I am going to have you do a few things. So first, lay down on your back.
Like all the way down?
Yeah. Okay, and to test flexion, I'm going to have him flex his knee to his chest, and, okay, yep. And then I'm gonna do it, that will be passive. Okay, and we would do that on either side. Now, you can either lay on your belly and do the extension, or you can just drop one leg off and kind of extend it back. So you might have to be close, yeah. Any pain there? Okay, so you can come back up. Okay, so then I'm gonna have you abduct, so you're going to remove this leg from the midline, okay? I'm gonna do passive here. Okay, and then adduct towards the midline. Yep. Passive. Okay. All right, so then I'm gonna have you flex to about 45, and we're going to internally rotate, externally rotate. Any pain? Okay. All right, so then we're going to do two specialty tests with this. We're going to do the Thomas test, where you're going to flex like we did initially for flexion. And I'm going to pull on the abdomen and see if you have any pain. Any pain? Okay, lovely. Next is Patrick's test. So you're gonna kind of make a 4. You're just gonna cross this, either one, yeah. And then I would push here to see if there's any laxity of the joints there. No pain? All right, so that concludes those two specialty tests. Now we'll move on to the spine. Okay, so for the spine, I'm gonna have you stand up. I'm gonna move you all around. Okay, so for the spine, okay, I'm gonna look at the spinous processes. I'm gonna inspect for symmetry. I'm going to inspect for the curvature of the spine from the side, any kyphosis, lordosis, scoliosis, and then symmetry at the shoulders and the hips, the iliac crest. And then in a normal exam, I would also look at the creases below the buttocks to make sure everything was in line. Then I'm gonna palpate. I'm gonna palpate the spinous processes and the intervertebral spaces. And then we would also percuss the spine. Okay, next I'm going to test range of motion. So I am going to sit behind you. You can stay just like that. And then I'm going to have you forward fold. So when he folds forward, I'm looking for range of motion. Normal should be about 90. I'm looking for any curvature of the spine. And I'm looking for hip symmetry, shoulder symmetry. Okay, you can come up. Okay, and And then for the rest of the range of motion, I'm gonna have you extend your back, so you're gonna go back, yep. And then, that's good. And then you're gonna go to lateral movement, so one side, yep. Other side, okay. And then you're gonna do rotation, so you're gonna rotate, yep, yep, rotate, perfect. And then one more test, a straight leg raise, so I'm gonna have you lay flat, and then that should do it. Okay, so you just relax. I'm gonna lift up. Any pain? Okay, that could. Okay. All right, perfect. And if there was pain or tenderness, that could be indicative of some sort of spine injury.